This video is for educational purposes only and does not replace official training, local protocols, or medical advice. Always follow your specific agency guidelines and medical control. Imagine your body is a major city and your blood vessels are the highways. When a person goes into severe shock, those highways completely lose their structure. They widen out massively, traffic slows down to a crawl, and vital organs, like the brain and kidneys, don't get the oxygen delivery they need to survive. Norepinephrine, often called Levophed in hospitals, is the ultimate emergency traffic controller. It is a powerful chemical messenger, a hormone and neurotransmitter, that the body naturally makes during a fight-or-flight emergency, but medical teams use it as a highly controlled IV medication to save lives when a patient's blood pressure is dangerously low. How it works, mechanism of action. Norepinephrine works by binding to specific molecular docks on cells called receptors, acting like a key in a lock to trigger a rapid survival response. When norepinephrine (NE) is released or given through an IV, it locks onto two primary types of targets on the other side of the nerve gap. 1. Alpha-1 receptors. The main target, these are located all over the walls of your blood vessels. When norepinephrine binds to them, it causes severe vasoconstriction, squeezing the blood vessels tight. Think of it like putting your thumb over the end of a running garden hose. The narrower the opening, the higher the pressure jumps, forcing blood back up to the vital organs. 2. Beta-1 receptors. The secondary target, these are located directly on the heart. Norepinephrine gives the heart a mild boost, causing it to squeeze slightly harder and pump more effectively, helping maintain consistent blood flow. Why it's a VIP in emergency medicine. In an ambulance or an ICU, norepinephrine is given as a continuous IV drip because it acts incredibly fast and can be finely adjusted down to the microgram. If a patient is in shock, their blood pressure is so low that their organs are literally starving. By continuously dripping this medication into the bloodstream, paramedics and critical care clinicians can precisely dial in a patient's blood pressure, adjusting the dose minute by minute to keep them stable while they fix the underlying medical emergency. When to use it versus when to hold back. Medical professionals have strict rules for when this drug is a lifesaver and when it can cause harm. Indications: when to give it. Septic shock, a massive, body-wide infection that makes blood vessels relax completely and leak fluid. Norepinephrine is the #1 choice to tighten them back up. Neurogenic shock, a severe spinal cord injury that disrupts the brain's ability to keep blood vessels constricted. Cardiogenic shock, when the heart is failing, though it is used carefully here so the heart doesn't have to push against too much resistance. Contraindications, when to avoid or be extremely cautious. Low blood volume, hypovolemia if a patient is bleeding out from a traumatic injury or severely dehydrated, the hose is empty. Squeezing an empty blood vessel with norepinephrine won't help and can actually cut off what little blood flow is left to the limbs. The priority here is blood and fluid transfusion, not squeezing the vessels. Vascular disease/clots, because it clamps down blood vessels so tightly it can completely cut off circulation to fingers, toes, or intestines if a patient already has severely damaged or blocked arteries.